You heard me correctly. 75% of the education doctors receive from the results of published medical research and taught by their specialty specific medical journals is just outright wrong. Hello, I'm Dr. Mark Richards, and welcome to the series, Nobody Wants You Healthy. This episode will give you an overview of not only the series, but also the three-pronged attack on your health and happiness. Watching these shows will give you the knowledge needed to make important choices for both you and your loved ones. Too many times, medical decisions are made based on the best of intentions, when in reality, they should be made based on proven results. Honest, objective results. Sadly, the corruption of science by profits, politics, and personal egos creates roadkill of the truth. My promise to you is that throughout this series, I will do my best to explain the honest medical science in an understandable, logical, and entertaining way. My mission is to give you the knowledge needed to get you and those you care about back to healthy. The book upon which this series is based has a title that makes people both laugh and upset. Most of us have figured out that except for our families, friends, and personal doctors, no corporate or political entity related to healthcare really wants us healthy. If we are healthy, their profits and their power over us goes away. Hence my book title, Nobody Wants You Healthy. Let's start by looking at the money trail. The leading Wall Street financial firm, Goldman Sachs, did an analysis of pharmaceutical companies' valuations back in 2018. Their straight-shooting analyst warned of a sharp drop in pharma company valuations if chronic disease prevention or cure ever became publicly known and available. Goldman's analyst wrote that there is no money in the prevention of disease and very little in a cure. The only sustainable growth business in healthcare is a continuous treatment of ever-increasing chronic diseases with drugs that neither cure nor prevent them. How about health insurance companies? Most of us would assume health insurance companies would want to save money by helping you prevent illness. But that's actually not true. Insurance companies can raise their premiums yearly based on how much they paid in claims the year before. And the percentage of your monthly premium that they're allowed to keep as their own corporate revenue is fixed by the governmental regulations at about 20 to 25%. It logically follows that the sicker you are, the more money they pay out in claims. The more money they pay out in claims, the more money they can charge in premiums. And the more money they charge in premiums, the more they can keep as corporate revenue. How about hospital systems? This is pretty obvious, actually. They only make good levels of revenue if you're sick and you use their services. And the quality of their medical services often doesn't really matter to their revenue. Finally, let's consider your personal doctor. The vast majority of them do indeed want you healthy, but they often do not know how to get you there. My medical school dean told our graduating class that we had received the finest medical education available, but he had an apology to make. He explained that 50% of what we were taught and memorized was not true, and that really our job over the next 40 years of medical practice was to figure out which 50%. Why would he say such a thing? Well, it was because during medical school, and even more so during continuing physician education after medical school, the money that funds medical research, medical journals, and medical specialty societies, and even our governmental health agencies of research and oversight is controlled by the businesses that only make profits if you're sick. This is a bizarre conflict of interest. As a result, it's now proven and accepted as fact that over 75% of research published in peer-reviewed medical science journals is false. You heard me correctly. 75% of the education doctors receive from the results of published medical research and taught by their specialty specific medical journals is just outright wrong. The landmark article that first exposed this finding came from Stanford University in 2005. It has since been accepted and confirmed as true by most national and global medical organizations. Some published studies are false due to accidental errors, but most are false by design in order to benefit the companies who funded the studies. It's no wonder that we're often frustrated by the lack of desired results from our medical treatments. Physicians are often doing their best, but they're relying on false information they assume to be true. If our currently prescribed treatments are so wonderful, then we should see a sharp decrease in chronic diseases and an increase in productive, happy lifetimes. Sadly, this is not the case. But there is something we can do, and it starts with what you will learn in each episode of Nobody Wants You Healthy. Despite everything I just stated, public enemy number one is not the pharmaceutical industry, nor is it the healthcare corporations. The real culprit responsible for the global epidemic of chronic and debilitating diseases is an invisible and yet powerful compound present in tiny amounts in our food, water, air, and personal care products. Public health enemy number one is a chemical that makes us chronically ill. Public enemy number one is phthalates. You're probably wondering, what the heck are phthalates? Well, phthalates are a highly useful class of chemicals that began in mass production in the 1960s. Production of them has exponentially increased since then. It's a chemical that makes plastics act like plastics. It gives plastics properties they need to be durable, flexible, tough, and so much more. Phthalates also have the ability to make thick fluids flow smoothly, so they can be found in your shampoo and other cosmetic products, and even in concrete. They are thought by many in manufacturing to be indispensable. But phthalates have a very dangerous side. You see, phthalates are the most powerful hormone-disrupting chemicals humans have ever mass-produced. They are called endocrine-disrupting chemicals, or EDCs. They interfere with the production and normal actions of hormones inside our bodies, and in fact, inside the bodies of almost every animal species on the planet. Hormones are how organisms larger than a few cells in size can communicate and coordinate all of their individual cells so they can work together as one. This is the only way a collection of cells can work together in a coordinated fashion. Properly functioning hormones are necessary for our billions of cells to act as one unit, the individual. It should not surprise us that the most abundant active hormone in our bodies is the one that controls inflammation, metabolism, neurological repair and function, cellular repair and maintenance, and sexual reproduction. Phthalates disrupt all these processes by disrupting the actions of this main hormone. We'll get to know the name of the well-known but grossly misunderstood hormone in just a little bit. But first, let's look at an example of the bizarre effects of phthalates on living creatures. The chemical industry now manufactures 200 times the toxic dose of phthalates for every human being on the planet yearly. Humans, like other animals on the planet, suffer greatly as a result. As an example of the power of phthalates, 3 of the rivers flowing into the nearby Chesapeake Bay have bass who are severely deformed. Over 60% of these bass are intersex, meaning they have both male and female parts on their body. This, of course, makes reproduction nearly impossible. In pregnant women, phthalate exposure has been strongly linked to ADHD and other learning and emotional disabilities in their offspring. But that's just the beginning. Phthalates cause disruption of our most abundant bioactive hormone, results in high rates of obesity, diabetes, depression, and other mood disorders, dementia, breast and prostate cancers, heart disease, strokes, infertility, menopause, thinning bones, frailty of aging, sexual dysfunction, and a host of other chronic diseases. 1.7 million Americans die of chronic disease every year. Over 80% of the $2 trillion we spend yearly on the US healthcare system goes to pay for chronic diseases. The elderly are affected even more. 96 cents of every Medicare dollar is spent on treating chronic disease. Yet there is a treatment successfully used since 1939 in the US that would reduce these diseases by over 50%. Medical education about this treatment stopped around 1960. As you will figure out while watching this series, the reason this therapy is not taught to physicians has a lot to do with the profits of those funding our medical education and medical research. Our ground, oceans, rivers, and even tap water are filled with phthalates. Microplastics containing phthalates are floating in the air over every continent. Approximately 95% of US tap water has phthalates in it. Recent studies have shown a shockingly high percentage of human beings actually have microscopic plastic in their blood. And as it would be expected, almost all humans have detectable levels of phthalates in their blood. We absorb phthalates through our skin, lungs, and GI tract. By disrupting our body's ability to control inflammation, metabolism, neurologic functioning, and sexual reproduction, phthalates have made the pharmaceutical industry and the healthcare industries very wealthy. Now that I've identified the problem that is making us sick, you have the knowledge base needed to explore with me how to get better. This knowledge has the potential to decrease pharma and healthcare industry revenues by 50%, but more importantly, improve your life many times over. Expect them to try to misinform you. Did you know the legal fiduciary responsibility of the healthcare-related industries is to their shareholders, their owners, not to the public or the doctors whose knowledge they are poisoning with false medical studies? Our path to better health starts with replenishing the most abundant bioactive hormone in men and women that's being depressed by phthalates. This hormone is the master hormone needed to control inflammation, metabolism, brain functioning, and sexual reproduction. Humans now are estimated to be over 60% lower in this master hormone than they were in 1960. Remember, the boom of phthalates was in the 1960s. What is this hormone? Well, it happens to be the hormone that medical schools spend much less than 30 minutes teaching their future doctors. It's a hormone for which pharma will not fund any research. Consequently, men and women inside and outside the medical profession have no knowledge of what this most important and abundant hormone does. The powerful master hormone is testosterone. I can hear women ask, what about estradiol? What about estrogen? Well, we have known since 2000 that testosterone directly creates all of the estrogen inside our cells, as well as the most important modulators of health that prevent or reverse chronic disease. Keep tuning in to Nobody Wants You Healthy episodes as we explore the fascinating actions of this hormone on almost every aspect of healthy human life. We will look at testosterone's actions on each of our organ systems and the science behind how restoration of adequate testosterone levels inside our cells enhances function and prevents disease. Importantly, you will learn the only currently available way to achieve sustained, steady state availability of this hormone inside all of our cells, despite our phthalate poisoning. And that concludes the first episode of Nobody Wants You Healthy. I look forward to seeing you again to help show you a better way to regain health and happiness.